Well, it's been recognized for some time now that health is one of the basic components of nation building, and providing capacity in health for the host nation will develop more um, feelings of ease, and people will be happy to cooperate with whoever is in the country to provide help and assistance. What's health specific for language and culture? And based on the initial assessments that we are doing right now, it doesn't seem there's much about health. It's more bigger concepts, and health is embedded every now and then. You see in general training things. We're trying to build up now more like a standardized curriculum on health component of language and culture. And we think it's very important, as health is one of the 6 pillars. Rand Corporation identified health as one of the 6 pillars of nation building, trying to identify more regional standards, local standards elsewhere in the world is very important for us to be more consistent with what we are doing. And host nations are always looking at us as models and symbols, and based not really sometimes on facts. They know the United States through media, through Hollywood, through other venues, but they are not very much sure how much we can do, and they expect usually more. Their expectation factor is very high always. People don't want to do things they don't know. So if we are not, and when I say we, I mean the United States, are not competent enough when we go outside and engage other nations, they will not understand the good means we are trying, or the good intentions we are having. So they might not cooperate well. So having proper cultural and language competencies to the level that the host nation will be comfortable dealing with us, and to show them the real intentions we are trying to do would be very much important. For us health people, we think if we can focus on the engagements that the United States is doing with other nations, health is one of the most peaceful engagements and the most places where we can talk to people, they can accept what we are offering them. Some people might show dignity in refusing like aid in the form of food, or but no one is rejecting health provided to a sick child, or even a vet who is trying to help a goat gets better because this is the only means of life for the family. So if we don't have the proper cultural understanding of that nation, and it's difficult to understand the whole world, but we're trying to come up with a generic product that has the fundamental basis of culture and language, and then this can be extended later on towards each engagement we have and each nation with its own specific differences, and like have some modifications to the basic core values. That's would be much more accepted and much more easy to learn. Billions of people are hungry, and nations are failing, and diseases are crossing borders without any respect to borders. They don't know about them. Viruses don't know borders, or bacteria, and it's a world of future problems. So many challenges are facing the whole globe, and the United States as a major international player will be there everywhere. So if we get ourselves more trained, more competent culturally and language skills, I'm not saying we are a school of language or a school of culture teaching. It's just trying to identify what's health specific for us. We are health people. And if we succeed in teaching our own people, going outside, engaging proper language and culture skills, barely enough so that they can manage their things and not like go through a very cumbersome process of learning and teaching, I think it will be very successful.